Hello, everyone. Today is April 2nd. My topic is the Canadian health officials are sending confusing messages to the public. So first, I want to talk about the use of mask. I know it's common sense. Right now, people are obsessed with so-called data, but data is past tense, and also it's not all the data are seeable, right? So all the data we have has limitations. So we need to reuse our common sense for our judgment. So masks can prevent more the transmission of the virus. That's common sense because there are two extra barriers between the two people. And I listened to the officials' comments that are using some sentences or knowledge to confuse the public, to confuse the reporters. For example, they said about N95 fit testing stuff, but for the general public, we are not wearing N95. We are not using the same resources as the hospital professionals. We are just using the regular, ordinary, disposable masks. And it doesn't need any fit testing. And the truth is, I think the truth behind they don't want to admit the benefit of wearing a mask is they cannot supply masks to the public. But actually, it doesn't matter. They can still tell the truth, the facts, and the people. We can figure out the supply ourselves. That's number one. So they can admit the benefit of wearing a mask and say the government doesn't have the energy or supply for every Canadian, but we're focusing on supplying the healthcare professionals in the hospital. I think that's fine, but don't just pretend there's no benefit of wearing a mask. Many countries already have the policy everyone should wear a mask, right? Proven to be effective. And that leads to another thing, is the supply thing. And the BC government, just last week, early this week, they had a law said you cannot secondary resell the masks and the other maybe supplies. So that confused a lot of people. A lot of people say people cannot sell masks. They interpret it this way. So a lot of people are afraid, or if they have a supply of masks, or they have extra masks they want to sell to other people, they are afraid. And I heard stories they are like fined by police. So that's also a confusing message. Right now, the problem is there's no supply of masks or other medical supplies. It's not that the price, it's not that the people don't want, there's no supply in the market, right? The government cannot supply it. So you don't want the business cannot sell or supply masks to the market, to the public at this moment. Most business cannot make profit from selling masks, I tell you, because the cost is very high and it's very competitive to buy, to import those supplies from other countries, because the whole world is short of the masks. So business doing it, actually, they provide more supply to the market and help to stop the transmission among the population. That's the good thing. I don't know why the government is trying to inhibit those business activities. And they also send a message said, I got the email said if you have blah blah supplies, please donate to the government. I think the government is saying, oh, we're helping the people, we're helping the small business, but they're asking the people to donate. If I'm I can import masks from China, it takes a long time because the logistics in Canada is horrible. But I can still import. And then I got a message, you cannot sell it or you have to donate it. So can you imagine anyone want to do that kind of business, want to do that kind of import anymore? So if there is no one doing the import or selling those business activities, there's no more supplies in our society. Okay, so the government can make up laws, but not good for the people. I don't know what they maybe sounds. Oh, people should not make profit in this crisis, but if there is no mask, there is no supply, everyone die. So that's the really bad logic and wrong message sent from the government. And then I want to talk about the testing. It's also a confusing message. Since the very beginning, the BC government can test 3,000 tests every day, and it has not been changed. Right now, there are more and more people get infected, and there's still 3,000 tests a day. And then you can see the number growing like linear. It's not normal in this situation. And every other province, you can see the growth really fast, but the BC, the growth is very flattened. It's not a real flattened, in my opinion, because we don't have enough testing, right? I remember our provincial health officer said in the very beginning, let's bring the number down first. What? Do you hear something wrong? Let's bring the number down first. It's not the actual infection, but the number show to the public. So that's really a confused. The numbers of positive tested patients is very confusing to the public. They may think BC situation is not very serious. Okay, we don't have that many, and the growth is slow now, and that will be confusing the public, and they may not practice as seriously, such as staying at home and other social distancing, and also wearing a mask. See in the grocery store, people are so close by each other, and because the aisle is only less than 1 meter wide, you cannot be 2 meters away from each other in the grocery store, in the market, in the supermarket. And I tell you, you don't need a sneeze or cough to infect other people. A lot of people talk really loud in the grocery store, in the shopping center. They talk loud without a mask, and the spit can infect other people. And they talk to another people 5 meters away and really loud. So those messages, I got really confused. I think many people get confused from the government. So I want people and health officials to start to use our common sense. Okay, it's a most contagious virus we are fighting now. Don't play games and use common sense and utilize the power of the private sector, the people's business activities to bring more supplies to our society and ask people to do more, not depress everything, because your government do not have the resources to help everyone. It sounds good. You want to do that. You give good speeches, but actually you don't have. So please face the facts and tell the truth.